I'm Jennifer Rayner. I am the colorectal cancer nurse specialist at St Mary's Hospital in the Isle of Wight. As a cancer nurse specialist, the week can be quite varied. There's some level of structure, whether being working with lots of different professionals, we have set clinics, but it's very varied to each individual patient. They have access to us all the time during our working hours. We might get called to endoscopy when people are being told new diagnosis. We could be asked to go to ED if there's emergency presentations there. And we basically support patients from the time they're diagnosed right the way through to either being discharged to palliative care or completion of their surveillance cancer-free. So it's a really, really varied role. I think the key skills of a clinical nurse specialist is empathy. That's your absolute key element, I think, in order to be able to engage with the variation of different people in different circumstances and being able to listen so you actually hear their angst and their worry so that you can then counteract that or reassure and make it as smooth as possible. I think it's important that you also keep your clinical knowledge up to date because there is just changes all the time, advances in treatments, and the patient's going to ask you these questions and they want those answers in layman's terms. So, you've got to know it inside out to be able to go, okay, this is what's going to happen and have that reassurance. So I became a cancer nurse specialist by having a cancer background from the beginning. I had a lot of cancer experience in my 3 years training to be a nurse. I then was recruited at Portsmouth Hospital and worked on an oncology ward there. And that's where I became chemo trained. I then moved back to the island and worked on the chemo unit here. Loved it, brilliant unit. And then as time went on, I was sort of seeing the work of the clinical nurse specialist and thought I really like to be part of that. Sort of seeing more of the patient journey, and I then became a band 6 working as a supportive CNS covering all areas. Enjoyed it all, and then as time was going on my manager sort of encouraged me to specialise down, and that's when I thought I'd had a very heavy experience with bowel and I thought okay, and the team had asked me and I thought that's the way I'm going to go, and no regrets. Lately we've been taking on a programme called trying to help diagnose Lynch syndrome. That's a national programme that's been implemented, and we've been training to do what we call mainstreaming, so testing, genetic testing and counselling in-house to help diagnose Lynch syndrome faster. Genetic testing is looking at the blueprint of what makes us us, and that comprises of our DNA. It's looking at that more specifically and what changes are there, and then that helps us guide things like treatments. I think it's because there's so much involved in it. I think there is huge variation. You rarely see 2 patients taking the same sort of pathway, all the difference in their personality, the family support. There's just so much reward in it, if I'm honest. Just being able to do one little task to put someone's mind at ease, that appreciation, and it feels like a great privilege.